I'm not sure exactly what I'm going to be doing after I graduate. And I knew that medical missions overseas was a possibility, but I was also wondering, how do I serve God if I stay here in the United States and I'm working at a hospital?
I've always been passionate about my relationship with the Lord, and I've wanted to be a doctor since I was like 8. And so I just wanted to figure out a way to put those two together, and I knew that traditional secular education isn't necessarily going to teach me that.
I felt like the time was right for me to have formal training in how I could integrate my faith with my medical education.
When I first heard about the METS preceptorship, I was really interested because the reason why I entered medicine was to integrate my faith into my vocation.
And as I've had clinical experience, I've encountered so many people where I've wanted to share with them, but I just didn't know how to. And I wasn't sure if I was allowed to.
It really is a completely different setting when you're talking to patients in the hospital versus maybe like talking to a friend over coffee.
And so when I heard about the preceptorship, I heard they were going to train us how to reach people with God's love in the hospital.
This allowed me to learn how to share with my patients why I'm physically caring for them, as well as emotionally and spiritually.
I've learned a lot just about how to approach patients when they're vulnerable, and I really enjoyed getting to have those conversations and meeting patients where they are and really listening to what they're feeling and thinking in the moment and where they're at coming to the hospital.
It was very surprising to see how open patients are about their whole self, not just their physical illness, but emotionally and spiritually, and how they have been affected by their illness.
I think like the first time I did it, I was a little nervous and a little fearful as well. I was thinking, how would they take this? You know, would they be offended even at me asking certain questions? And so those were some obstacles I had, but really I was really surprised to find that a lot of the patients are really seeking that and desiring for someone to ask about how they're doing emotionally and spiritually.
So here at the Preceptorship, they've told us the ethics behind talking about God, praying with patients, and just listening to their needs.
This preceptorship showed me how to have those 5-minute spiritual conversations, how to share your testimony in 2 or 3 sentences and still be effectively communicating the gospel.
Beyond the medical aspect, this preceptorship has been great in terms of just getting spiritual nourishment, being surrounded by like-minded people, and just being encouraged overall.
All the speakers were really amazing, and they just have a lot of wisdom and insight into practicing spiritual care with their patients, and I really enjoyed the stories and listening to how spiritual care has affected people's lives. Seeing the impact that I can have as a physician someday on someone who's in that stage of life is really, it's humbling, and it showed me that I have a lot of responsibility.
And it's been really awesome to be able to incorporate my faith in caring for the patients out here in Redlands, and I'm really excited to go back and put it into practice.